Hi, my name is Matheus Baixos. I'm here to present this work. Evidence for efficacy of physiotherapy interventions for older people with non-specific low back pain is scarce. A systematic review with meta-analysis. Non-specific low back pain is one of the main reasons why older people seeking care. However, the efficacy of physiotherapy interventions on clinical outcomes for this population is not yet well established. Findings of younger populations with non-specific low back pain cannot be generalized due to specificities related to aging. This thematic review investigated the efficacy of physiotherapy interventions on important clinical outcomes in older people with non-specific low back pain and assessed the strength of the evidence through the grade recommendations. The protocol was prospectively registered in the Prospero CRD 153845. Searches were conducted on Medline, Ahmed, Embase, Cochrane, PsychoInf, and Pedro up to 2020. Randomized controlled trials were included when the investigated participants aged 60 years old or older, with non-specific low back pain of any duration. RCTs were eligible if they investigated the efficacy of conservative treatment, defined as any form of non-invasive procedure, i.e., education, exercise, compared with control group, i.e., no intervention, waiting list, placebo, or sham. Risk of bias was assessed using the 0 to 10 Pedro scale. Study selection, risk of bias assessment, and data extraction were conducted by two independent reviewers, and a third reviewer resolved discrepancies. Outcome data was extracted from all groups of interest to investigate short, medium, and long-term effects. Short-term effect was considered follow-up up to 3 months. Medium-term effect was considered follow-up over 3 and less than 12 months, and long-term effect was considered follow-up of at least 12 months. Weighted mean difference with 95% confidence interval were reported of each specific treatment, and the strength of the evidence was assessed using the grade recommendations. Minimal clinically important difference was assessed considering small effect size WMD less than 10% of the scale, medium effect size WMD equals 10% to 20% of the scale, and large effect size WMD greater than 20% of the scale. 11 RCTs were included investigating effects of physiotherapy interventions on disability, pain, coping strategies, quality of life, strength, balance, depression, falls, sleep quality, mobility, body mass index, percentage body fat, trunk muscle mass, and waist to rib ratio. In the short term, moderate quality evidence showed large effect size of trigger point acupuncture on pain outcome when compared with control. In the short term, moderate quality evidence showed that trigger point acupuncture and exercise had a medium and small effect size respectively for disability outcome when compared with control group. This thematic review provides moderate quality evidence that exercise and trigger point acupuncture have benefits on disability and pain in older people with non-specific low back pain at short term. This is my reference. Thank you.